Stop. Before you take that pill sitting in your medicine cabinet, you need to hear this. There are 7 medications I see men taking every single day that are quietly destroying their health. And gentlemen, 3 of these are killing your erections and your performance in the bedroom. That's right. 3 of these medicines are making it more difficult for you to get hard, stay hard, and engage in sex. Did you know? Let's talk. Look, I'm not here to sugarcoat this. I've watched people pop pills like candy without them understanding what they're actually doing to their bodies. Some of these medications, they're necessary, life-saving even, but others, they're being overused, misused, and causing problems that nobody's talking about, especially when it comes to men's sexual health, energy levels, and overall vitality. Today, I'm breaking down 7 medications that deserve a serious second look. I'll explain what they do, the problems they cause, and what alternatives actually exist. This isn't fear-mongering. This is the truth about how these 7 medicines can wreck men's health and sexual well-being. Before we begin, remember, this is educational information here, not personal medical advice. Never stop or start taking prescribed medications without consulting your doctor first. Stopping certain medications abruptly can be dangerous. Always talk to your healthcare provider before making any changes. Got it? Good. Let's dive into the 7 common medications crushing men's health, sexual health, and, most importantly for guys, their erections. Medication number 1, proton pump inhibitors, PPIs. First up, proton pump inhibitors, PPIs for short. Brand names like omeprazole, Prilosec, Nexium, Lansoprazole. These are prescribed for acid reflux, heartburn, and ulcers. They work by completely shutting down acid production in your stomach. Here's the issue. Millions of people are on these long-term when they were only designed for short-term use. We're talking 8 to 12 weeks maximum in most cases. But people stay on them for years, even decades. What happens? Your stomach acid exists for a reason. Without it, you can't absorb vital nutrients, especially magnesium, calcium, vitamin B12, and iron. Long-term use has been linked to increased risk of bone fractures, kidney disease, dementia, and infections like pneumonia and C. diff. For men specifically, low magnesium and vitamin B12 directly impact testosterone production and energy levels. Poor nutrient absorption means lower vitality, worse recovery from exercise, and yes, erectile dysfunction. That means you can't get an erection. Your body needs these nutrients to produce nitric oxide, which is absolutely critical for blood flow and erections. What to do instead? Work with your doctor to address the root cause of your reflux. Often, it's diet-related. Too much processed food, alcohol, caffeine, eating late at night. Lose excess weight if needed. Consider H2 blockers like famotidine as a less aggressive alternative. If you've been on PPIs for more than a few months, talk to your doctor about tapering off. Don't stop cold turkey, or you'll get rebound acid that's worse than before. Medication number 2, statins. Number 2, statins. Atorvastatin, simvastatin, rosuvastatin, prescribed to lower cholesterol. Now, statins can be life-saving for people who've had heart attacks or strokes, but they're also handed out like candy to people with slightly elevated cholesterol who might not need them. The dark side, muscle pain and weakness affect up to 30% of users. They deplete coenzyme Q10, which your cells need for energy production. This leads to fatigue and muscle problems. There's also evidence linking statins to increased diabetes risk and cognitive issues. Men's health impact. Here's what nobody tells you. Cholesterol is the building block of testosterone. Your body literally makes testosterone from cholesterol. When you aggressively lower cholesterol with statins, you may be tanking your testosterone levels. Studies have shown statins can contribute to erectile dysfunction and reduced libido. Some men report feeling like their drive, in every sense of the word, just vanishes. Alternatives. If your cholesterol is only mildly elevated and you haven't had a cardiac event, lifestyle changes work incredibly well. Cut out refined carbs and sugar. These raise triglycerides and small, dense LDL particles that are actually dangerous. Increase fiber intake. Exercise regularly, especially resistance training, which boosts testosterone naturally. Omega-3 fatty acids from fish or quality supplements help. If you must take a statin, Supplement with CoQ10, 100 to 200 milligrams daily to counteract the depletion. And get your testosterone checked. Seriously, before we continue, if this information is hitting home, do me a favor. Hit that like button and drop a comment below telling me which medication you're most concerned about. Subscribe if you want more straight talk about health that doctors aren't always transparent about. Now, let's keep going because the next one is prescribed to over 20 million people. Medication number 3. Benzodiazepines. Number 3, benzodiazepines. Xanax, Valium, Ativan, Klonopin, prescribed for anxiety, panic attacks, and sleep issues. These are some of the most addictive medications legally prescribed. They work by enhancing GABA in your brain, which calms you down. Sounds great, right? Wrong. Your brain adapts quickly. Within weeks, you build tolerance. What worked last month doesn't work this month. You need more. And when you try to stop, brutal withdrawal that can include seizures, severe anxiety worse than what you started with, insomnia, and psychological hell. In men's health, benzos suppress your central nervous system. That includes the signals needed for sexual arousal and erections. Long-term use is linked to erectile dysfunction, delayed ejaculation, and reduced testosterone. They also trash your sleep architecture. You might feel sedated, but you're not getting quality REM sleep, which is when your body produces most of its testosterone. Better options are cognitive behavioral therapy for anxiety is as effective as medication without the side effects. Regular exercise, especially high-intensity training, naturally regulates anxiety. Magnesium glycinate can help with anxiety and sleep without being addictive. L-theanine, ashwagandha, and proper stress management techniques. If you're already on benzos, never stop abruptly. This must be done with medical supervision through a slow taper, but have that conversation with your doctor. Medication number 4, antidepressants, SSRIs. Number 4, selective serotonin, reuptake inhibitors, SSRIs, Prozac, Zoloft, Lexapro, Paxil. These are prescribed for depression and anxiety, and for some people, they're genuinely helpful and necessary. But here's the uncomfortable truth. SSRIs have a massive sexual side effect profile that doctors often downplay or don't mention at all. We're talking reduced libido, erectile dysfunction, difficulty reaching orgasm, and delayed or absent ejaculation. Some studies show up to 70% of people on SSRIs experience sexual side effects, and it gets worse. For some people, these effects persist even after stopping the medication. It's called post-SSRI sexual dysfunction, or PSSD, and it can be permanent. Your serotonin system is deeply connected to sexual function, and messing with it has consequences. Alternatives? If your depression is mild to moderate, exercise has been shown in studies to be as effective as SSRIs. No joke. Therapy, particularly CBT. Address nutritional deficiencies, vitamin D, B vitamins, omega-3s. Consider bupropion, Wellbutrin, instead. It works on dopamine and norepinephrine rather than serotonin and has a much lower sexual side effect profile. Some men even report improved libido on it. If you're on an SSRI and experiencing sexual issues, talk to your doctor about switching medications or adjusting dosage. Don't just accept it as inevitable. Quick pause. Now, I want to talk about something that can help support your overall health while you work with your doctor on these medication issues. Many of these problems come down to poor blood flow, low testosterone, nutrient deficiencies, and systemic inflammation. If you've been feeling frustrated or even embarrassed about changes in bedroom performance, sensitivity, stamina, or desire, you're not alone, and it's not your fault. There's a 100% natural solution that's already helped thousands of men feel confident and energized again. No pills, no injections, no procedures, no surgery, no risky shortcuts. Just a simple, easy home remedy you can make at home, designed to support what researchers are now calling the manhood molecule, a key factor for arousal, blood flow, and lasting power. Find out more. There's a link in the description and in the pinned comment. Check it out if you're serious about taking control of your health. We're halfway through, and these next 3 are even more common. If you're finding this valuable, share it with someone who needs to hear it. Let's continue. Medication number 5, Antihistamines, first generation. Number 5. First generation antihistamines. Diphenhydramine, that's Benadryl, Tylenol PM, Advil PM, and about 100 other products. People pop these for allergies and sleep without thinking twice. The danger? These cross the blood-brain barrier and affect your central nervous system. They're anticholinergic, meaning they block acetylcholine, a neurotransmitter crucial for memory, learning, and muscle function. Long-term use is linked to increased dementia risk. They also cause next-day grogginess, impaired reaction time, and cognitive fog. For men's health, anticholinergic drugs interfere with the parasympathetic nervous system, which controls erections. Regular use can contribute to erectile dysfunction. They also suppress REM sleep, affecting testosterone production and recovery. Better choices. For allergies, use second-generation antihistamines like cetirizine, Zyrtec, or loratadine, Claritin. They don't cross the blood-brain barrier. For sleep, address the root cause. Sleep hygiene, magnesium glycinate, melatonin short-term, or talk to your doctor about non-anticholinergic options. Don't use Benadryl as a sleep aid habitually. Medication number 6, opioid pain medications. Number 6, opioid pain medications. Hydrocodone, oxycodone, codeine, tramadol. The addiction crisis speaks for itself. These are incredibly addictive, and dependence can develop in just days to weeks. Beyond addiction, opioids cause constipation, respiratory depression, and hyperalgesia, where you actually become more sensitive to pain over time. Your body fights back. Men's health impact. Chronic opioid use suppresses the hypothalamic pituitary gonadal axis, the system that controls testosterone production. Men on long-term opioids develop opioid-induced hypogonadism, severely low testosterone. This means erectile dysfunction, loss of muscle mass, fatigue, depression, and infertility. Some studies show up to 90% of men on chronic opioids have low testosterone. Alternatives. For chronic pain, explore physical therapy, acupuncture, anti-inflammatory diets, turmeric, curcumin supplements, and non-opioid medications like gabapentin or certain antidepressants designed for nerve pain. Exercise and movement. Counterintuitive, but often effective. CBD may help some people. If you're on opioids long-term, get your testosterone checked and work with your doctor on pain management alternatives. Medication number 7, blood pressure medications, beta blockers. Number 7, beta blockers, metoprolol, atenolol, propranolol, prescribed for high blood pressure, heart conditions, and sometimes anxiety or migraines. They work by blocking adrenaline, slowing your heart rate, and reducing blood pressure. The issue, they're effective for heart disease, but they're often prescribed as first-line treatment for simple hypertension when better options exist. Beta blockers can cause fatigue, cold hands and feet, dizziness, and weight gain. They can mask symptoms of low blood sugar if you're diabetic. Men's health impact. This is the big one. Beta blockers are notorious for causing erectile dysfunction. They reduce blood flow and can make it difficult to achieve or maintain an erection. They also reduce exercise capacity and can make you feel sluggish and unmotivated. Better options for blood pressure. If you don't have a specific heart condition requiring beta blockers, ACE inhibitors or ARBs might be better choices with fewer sexual side effects. But honestly, for many men with early hypertension, lifestyle changes are incredibly effective. Lose excess weight, reduce sodium, increase potassium, eat more vegetables, exercise regularly, especially cardio and strength training, limit alcohol, and manage stress. Some supplements like magnesium, CoQ10, and beetroot extract, which boosts nitric oxide, can support healthy blood pressure naturally. Always work with your doctor, but don't just accept beta blockers as the only option if your sex life is suffering. Closing recap. All right, let's recap quickly. 1. PPIs for acid reflux. Long-term use depletes nutrients and affects sexual health. Find the root cause instead. 2. Statins for cholesterol. They may lower your testosterone and cause ED. Lifestyle changes work for many people. 3. Benzodiazepines for anxiety. Highly addictive and kill your sex drive and sleep quality. 4. SSRIs for depression. Major sexual side effects that can be permanent. Consider alternatives like Wellbutrin. 5. First-generation antihistamines linked to dementia and ED. Use newer antihistamines. 6. Opioids for pain. Tank your testosterone and cause severe ED. Explore non-opioid pain management. 7. Beta blockers for blood pressure, notorious for causing erectile dysfunction. Ask about alternatives. Look, some of these medications are necessary and life-saving. I'm not saying throw them out. I'm saying be informed, ask questions, and explore alternatives with your doctor when possible. Call to action. Here's what I want you to do right now, and I'm serious about this. First, take out your phone, open your notes app, and write down every medication you're currently taking. Then schedule an appointment with your doctor and have an honest conversation about whether you still need them, what the side effects are, and what alternatives exist. Second, if this video opened your eyes, smash that like button, subscribe to this channel, and turn on notifications. I'm going to keep bringing you the truth about health that most people won't tell you. Third, drop a comment below telling me, have you experienced any of these side effects? Which medication concerns you most? What topics should I cover next? Fourth, share this video with any man in your life who's struggling with low energy, sexual problems, or taking multiple medications. This information could literally change someone's life. Now, watch this video for more revealing know-how on men's health and well-being. Don't just watch and forget. Take action. Your health and your performance depend on it.